Good afternoon, everyone, and welcome to today's session. Today's session will be about a plant-based diet for type 2 diabetes prevention and management, and we welcome you all. I am here today on behalf of the University of Nicosia Medical School and the University of Nicosia Medical Center. My name is Maria Cecilia Mosquera. I am a clinical assistant professor in the Department of Primary Care and Population Health. I'm also certified in lifestyle medicine and obesity medicine, which is why we're here today to talk about a plant-based diet. This week, we have celebrated World Diabetes Day on the 14th of November. So this talk today is on the occasion of World Diabetes Day. So we'll be talking about diabetes and specifically type 2 diabetes. So I mentioned before that I'm a lifestyle medicine physician. For those of you that are not aware, lifestyle medicine has 6 pillars. It focuses not just on healthy eating and physical activity, but also on managing stress, having healthy relationships, having restful and restorative sleep, and avoiding risky substances. So today, specifically, we're going to be talking about the healthy eating pillar of lifestyle medicine. And our goal with this conversation is to learn more about how a plant-based diet can help prevent and manage type 2 diabetes. Specifically, we're going to be going through 4 parts in our conversation today. The first is we're just going to give an overview of what is type 2 diabetes to make sure we're all on the same page. Then we're going to go through the role of a plant-based diet in diabetes, and we're going to talk about what is a whole food plant-based diet. And then we're going to give some tips on how to move towards a whole food plant-based diet. Today's session will be an hour, and as I said, I'm a lifestyle medicine physician, so I encourage you to please stand, stretch, or move as you watch this presentation today. And as we are in the presentation, if you have any thoughts or questions, please feel free to write them in the chat box if you are watching on YouTube Live. In addition, if you were watching this as a recording, because this presentation will be recorded and posted after our presentation finishes today, these are the instructions for how you can turn on the closed captions in Greek once the recording has been posted. So first, let's start with what is diabetes to make sure we're all on the same page. First off, let's talk about glucose or sugar. So glucose comes mostly from the food that we eat, as in all the things you see in the image on your screen. And glucose levels rise in your blood after you eat. But glucose doesn't only come from table sugar. Glucose comes from carbohydrates, and there are different types of carbohydrates. On the screen here, you can see that there are starches and sugars. So sugars are things like honey, table sugar, maybe the fruit juice that you drink, or the fruit that you eat, or a cookie, or a chocolate, cake, or milk. But starchy carbohydrates, or the starches, are things such as breads, rice, pulses or legumes, and potatoes. So there are different types of carbohydrates. And glucose, the purpose of glucose is to give your body energy. And your body, in order to use this glucose, needs something called insulin in order for your body to be able to make energy. Insulin comes from a part of your body that's called the pancreas. You can see in the image here that it's traditionally towards the left-hand side of your abdomen. So insulin is made by the pancreas. And when we're talking about diabetes, your body doesn't have appropriate insulin. In diabetes, your body either doesn't have enough or any insulin or can't use its insulin. So if your insulin isn't working appropriately or you don't have enough, then insulin can't help your body use the glucose in your blood. So what happens is the level of your glucose in your blood gets too high. And that's what happens in diabetes. So many of us have normal glucose, but there are some who have a little bit high glucose in their blood. That's called prediabetes. And when it's too high, it's called diabetes. And this is measured by when you go to your doctors or your clinic, then they will do some tests and they'll tell you if you have prediabetes or diabetes. Now, there are different types of diabetes. Today, specifically, we're going to be talking about type 2 diabetes, but just to mention the differences between type 1 diabetes and type 2 diabetes are, if we talk about type 1 diabetes, the pancreas can no longer make insulin. and it can't make insulin from the very beginning. But the difference with type 2 diabetes is that in the beginning, the pancreas can't make enough insulin or it doesn't work properly. But over time, people with type 2 diabetes, it can happen that your pancreas also cannot make insulin. So most people, when we talk about diabetes, have type 2 diabetes. As I mentioned, there's another type called type 1, and there are also other types of diabetes. But this is an image from the UK, but in the most part, the vast majority of people who have diabetes have type 2 diabetes, which is why today's conversation will be about type 2 diabetes. So let's say your doctor has told you that you either have pre-diabetes, which means that you're at risk of developing diabetes, or you actually have type 2 diabetes. Why do we need to worry about this? Why do we worry about type 2 diabetes? Type 2 diabetes can lead to many problems and complications, such as having a heart attack, stroke, developing kidney problems, which we call nephropathy, developing problems with your nerves, which we can call neuropathy, developing eye problems, which we call retinopathy, foot problems, gum disease, mouth problems, sexual problems. There are many problems and complications that type 2 diabetes can lead to. But is diabetes only about sugar or glucose? Well, no. Having diabetes, if you also have high cholesterol and high blood pressure or high blood pressure, that means that you're at even higher risk of having a heart disease, heart attack, or stroke. So when you have diabetes, you want to also keep track of your cholesterol and your blood pressure. And when you go to the clinic, your doctor will be thinking about those things, or your clinic team. So you also, in your diet, want to think about your fat and salt intake. So let's shift and talk specifically about what is the role of a plant-based diet in type 2 diabetes. So I mentioned that the name of this talk is plant-based diet for type 2 diabetes prevention and management or treatment. So first, let's talk about preventing type 2 diabetes. So if you don't have diabetes, how can we prevent you from getting type 2 diabetes? Well, first, it's important to know that eating meat, specifically red meat, even once a week has been shown to increase the risk of developing diabetes. And from here on, whenever I say diabetes, I'm talking specifically about type 2 diabetes. So eating meat increases the risk of developing diabetes, particularly if the meat is processed. So processed meats are like salami or hams that are either salted, cured, or smoked. But we know that eating a plant-based diet actually lowers the risk of developing type 2 diabetes. And there are studies that have shown, like the large Adventist health study, that the less animal products you eat, the less your risk of diabetes. So people who eat meat in their diet have more risk of developing diabetes than people who, for example, are vegan. And that risk decreases as you eat less and less animal products. So non-vegetarians have more risk than semi-vegetarians. Semi-vegetarians have more risk than pesco-vegetarians. Pesco-vegetarians have more risk than lacto-ovo-vegetarians. And lacto-ovo-vegetarians have more risk than vegans. So vegans have the lowest risk of developing diabetes when we compare to the groups of people that are here listed on the screen. Now that was the prevention of type 2 diabetes. I also mentioned that we were going to talk about the management or treatment. So what if you already have type 2 diabetes? Your doctor has told you have diabetes or you have pre-diabetes. Well, plant-based diets can help treat and even reverse diabetes for a variety of reasons. For example, the foods are lower in fat, higher in fiber, and they have higher water content. Overall, this means that you're eating less calorie dense food. So you're eating lower calorie density foods. This can help you maintain a healthy weight and a healthy fat mass, and can lead to improved glucose control and less insulin resistance. So there are a variety of reasons why eating plant-based foods predominantly can actually help treat your diabetes or even reverse it. So I mentioned before about weight because many people with type 2 diabetes are actually overweight or obese. And with diabetes, getting to and maintaining a healthy weight can actually help you feel better, improve your blood pressure, and help your cholesterol, and also reduce the risk of those complications we mentioned before, such as the complication with your eyes, feet, and heart. So, what's important for us to talk about is that there are people who have diabetes, type 2 diabetes, that are able to stop taking their medication and put their diabetes into remission through lifestyle changes, particularly weight loss. But lifestyle changes also include diet, which we're talking about today. So, it is possible to put your type 2 diabetes into remission, which means that basically when you check your blood levels, they're all normalized through lifestyle changes. So think about that. Now let's talk about what is this whole food plant-based diet that I'm talking about today. So a whole food plant-based diet is one in which you eat mostly a variety of minimally processed vegetables, fruits, whole grains, legumes, nuts, and seeds. And notice that I said mostly and a variety, right? So if we look at this plate right here, you can see that the plate is filled mostly with fruits and vegetables, and the proteins that are on the plate are things such as legumes and pulses like chickpeas and black or red beans, lentils. There are nuts and seeds. You can see some almonds, maybe some flax seeds. And when we talk about the grains that are on your plate, instead of white rice, a white potato, white bread, you can see a whole grain bread, whole grain pasta, brown rice, things that have fiber and are whole grains. And you see that as a beverage, it's water. So, we're talking about a whole food plant based diet, but what does that mean specifically? Because there are actually different types of plant based eating patterns. And although I'm calling this the whole food plant based diet, in reality, it's a pattern of eating, a way of eating. So, there are a variety of plant based eating patterns, one of which is the Mediterranean diet. And right now I'm in Cyprus. And in Cyprus, the original traditional diet was the Mediterranean diet. I say was because not everybody that lives in Cyprus or in other Mediterranean countries is eating the traditional Mediterranean diet. So, what is the traditional Mediterranean diet? It's a diet that's high in vegetables, fruits, legumes, nuts, beans or pulses, cereals, and whole grains. It also includes fish and unsaturated fats, specifically olive oil, but it's low in meat and dairy foods. So notice that the top row of items that are listed there are really what I've described as part of a whole food plant-based diet. Now, that is the Mediterranean diet. It is a plant-based eating pattern. But there are also vegetarian diets, like if you are pescatarian or pesco-vegetarian, you might exclude meat and chicken from your diet, but you would eat seafood and everything else. Now, if you're lacto-ovo-vegetarian, it sounds like a very fancy word, but it basically means that you eat milk products, egg products, but you won't eat any meat, fish, or poultry. And then vegans are people who exclude all animal foods from their diet. So you can see that there are a variety of types of diets that are also plant-based eating patterns. And here in Cyprus, we're rather fortunate in that we're surrounded by a multitude of foods that fit within the plant-based eating pattern within the Mediterranean diet. You'll see here olives and fruits and vegetables and legumes and pulses and seeds and whole grains. We're really lucky and fortunate that we can access these types of foods here and we can take advantage of them. So now that I've shared with you what a whole food plant-based eating pattern is like, let's go through some common questions that might arise. Because you might be asking, does that mean that I need to give up my meat and actually become vegan? Well, not necessarily. We're going to talk about why that later, but it's also important to notice that a vegan diet is not necessarily a healthy diet if it's filled with junk food or highly processed food. Because you might notice nowadays you can go to the stores and you can find all kinds of foods that are packaged and processed, but they're vegan. So let's talk about that more in detail. Now, if you look at this slide here, you look at the left-hand side of your screen, we're going to start with what is an unprocessed food. So these are the natural parts of plants and animals, like your fruits, your vegetables. Nothing's been done to them. You take a carrot from the ground, maybe you rinse it, and that's it. There's nothing else that's been done to process that carrot. Now, if we move towards thinking about what is a minimally processed food, so if you want to preserve those foods that come from nature, let's say you collect some beans and you freeze them so that you can use them for later, or you take some pulses and you dry them, or you take some almonds and you grind them into an almond butter. You've minimally processed your food. You've done just a little bit to be able to process it, usually to be able to preserve it and use it later, because you don't want to eat all your food on the same day. If, let's say, you have a harvest full of almonds, you want to save some for later. That is called minimally processed foods. Processed foods do even more to that particular food. So they may add salt, sugar, or fats. If you look at the list of ingredients for that food, it might actually have 2 to 3 ingredients, maybe even more. And those can be readily eaten without further preparation. So let's say bread or canned beans where they actually have salt and sugar added, or olives that you've brined with salt, and cheese that you've also used salt to make it. So these are actually processed foods. Although they're not heavily processed, they've been processed so that we can save them, use them, so that they won't go bad on the second that you eat them, and so that we change them slightly from milk, for example, into a cheese. Now, the last category are highly or ultra processed food. So these foods involve multiple steps to get to that final product. They may have artificial colors or flavors. These are like some of the chips that you may buy in the store that have, artificial coloring, or the beverages that have artificial coloring and flavoring, and they have, 15 ingredients when you look at that ingredient list. So the idea is that we want to focus on unprocessed foods for our diet as much as possible. So our eating pattern should include mostly unprocessed and minimally processed foods, and the minimal amount of highly or ultra processed foods if feasible. So more unprocessed, less processed foods, because our goal is to move towards eating a pattern of foods every day that is mostly minimally processed or plant-based. So that would be a whole food plant-based diet. So notice it's important to call this a whole food plant-based diet. You don't want to think just about a plant-based diet that's full of junk food. You want to think about a whole food plant-based diet. So here is an example. On the left-hand side, you can see what a meal might look like that is an ultra-processed, where you're eating white bread with a processed ham and a processed cheese. And then you have some potato chips that have been processed and fried and added salt and maybe some flavorings. You also have artificial lemonade. Whereas on the right-hand side, you have a minimally processed meal that includes cucumbers and tomatoes and apples and a whole grain like barley. It includes steamed broccoli. And in this particular image, it shows grilled beef, which is a whole food. If we're talking about a fully plant-based diet, the beef would not be on the plate. But you can see the difference between what an ultra-processed versus a minimally processed plate would look like. So the right-hand image is more whole food, mostly plant-based. Now, that was the first question. The second question that you might be thinking about is, maybe you have diabetes and you've thought that you were supposed to avoid carbohydrates because of your diabetes. Well, yes, you want to avoid processed carbohydrates as much as possible. The sugars, the white flours, the chocolate cake, the cookies, because processed carbohydrates are absorbed much more quickly by your gut than unprocessed carbohydrates. So, what happens is that glucose, that sugar level in your blood, goes up too quickly. But there are unprocessed carbohydrates in whole foods that are better than processed carbohydrates because they're higher in fiber and they take longer to digest. So, what happens is your glucose level in your blood goes up much less than if this were a processed carbohydrate. So, you don't necessarily have to avoid all carbohydrates. You talk to your doctor and your clinic team because they know your health condition, but if you were to eat carbohydrates, the better carbohydrates to eat are whole food, whole grain carbohydrates. And what are some examples of those? If you see the image on the right hand side, that might be your brown rice instead of your white rice, or your millet, or your barley, or your whole grain oats, or your whole grain pasta, whole grain seeded bread, for example, as opposed to your white bread. Okay, third question you might be thinking about is, hey, maybe you heard that you thought you were supposed to avoid fruit because you have diabetes. Well, not if you focus on eating a varied whole food plant based diet. If you're mostly eating a whole food plant based diet, there's no reason why you should be avoiding fruit, and you can talk to your clinic team to be certain based on your own personal condition. But I'll share with you there have been studies, like three large studies, that showed that actually eating more whole fruits, specifically in those studies, blueberries, grapes, and apples, was actually associated with a lower risk of diabetes. But drinking more fruit juice was associated with a higher risk of diabetes. So eat your fruits, don't drink your fruits, right? Just the whole fruit itself, the apple, the orange, is a whole food. The orange juice, the apple juice, is not a whole food, it's been processed. Okay, so let's go to question number 4. But I thought that if I eat a fully plant-based diet, I'm going to need vitamins. Well, it depends. If you're going strictly plant-based, then you want to talk to your clinic team to ensure that you're eating enough foods that contain specifically vitamin B12, which is something that people who are vegan and fully plant-based, for example, have to be careful about with their diet and discuss with their healthcare professionals. In addition, if you are moving towards mostly plant-based, you also want to make sure that you're choosing foods that are high in iron, like legumes and pulses and greens, and also that you're thinking about your vitamin D and calcium. So it doesn't automatically mean that you're going to need vitamins or supplements if you're on a whole food plant-based diet, particularly if you're eating a varied diet. So talk to your healthcare professional. You want to make sure that the types of foods you're choosing are filling all your nutrition needs, but it doesn't necessarily mean you're going to need vitamins. So now let's get to the nitty gritty of how you can actually move towards a more whole foods plant-based diet. And let's start with what it might look like if you were eating a meal in Cyprus tonight. So in Cyprus, for example, we might get served a village salad that can include, vegetables as well as potentially some cheese. Maybe you've gotten some appetizers that include some bread, maybe some bread with sesame or some pita bread and some tahini sauce, maybe some olives. And then after you've eaten all of that, you're served your plate. Maybe it's some burguri, or maybe with some chicken and potatoes. And then after you've eaten all of that, and maybe you had a glass of wine or a beer with it, after the whole meal is finished, maybe you might have a spoon sweet and a bit of coffee. So that's a full spread, maybe something you might not eat, hopefully on a daily basis, but maybe let's say on weekends or when you're out with family or you're having a large family meal. So you can see that's a multi-course meal right there. And what you want to think about is if you were to envision how much food and what types of food you actually had on your plate in a whole food plant-based diet, you want to think about it this way. Divide your plate like that image on the left-hand side so that half of your plate is filled with fruits and vegetables. So let's say you had that village salad with just the tomatoes and the cucumbers and the lettuce and the bell peppers, let's say. And then on 1/4 of your plate, look at the right-hand side, you filled it with a protein. Let's say you actually chose black-eyed peas. Just recently was black-eyed peas season here in Cyprus. So maybe you chose to fill 1/4 of your plate with black-eyed peas, and then maybe you chose a whole grain, like a whole grain barley or a whole grain. Maybe you had some whole grain bread or pasta or brown rice, or maybe you had some burguri. But that was just 1/4 of your plate, as opposed to almost all your plate filled with a grain and a meat, and not so much fruits and vegetables. And then as a beverage, you want to focus on your water as much as possible. So that would be an example of how you would fill your plate to move it towards being a whole food, plant-based plate. And now let's point out what you might see some of the differences. So on the left-hand side is a plate of dish we actually ordered, and was one of my family members was given this as a plate. It was actually more of a platter than a plate because of its size. But you can see that it had French fries and it had burguri, and then it had meat, as opposed to the plate on the right-hand side, which had half fruits and vegetables. 1/4 of the plate was filled with legumes, and the other 1/4 was filled with whole grains. So there's a difference here with the proportion of how much grains and meats you're eating, how much more fruits and vegetables you have on the right-hand side plant-based plate, and then the fact that you've chosen a plant-based protein instead of a red meat. So the idea is to focus on whole grains, legumes and pulses, vegetables, fruits, nuts, and seeds. Remember, that's what we said is a plant-based diet. So here are some examples. Let's go through what a whole day might look like. Let's say you start with breakfast. For example, these are some almond flour pancakes with whole grain flour and flax, that were made for breakfast, along with a salad of cherries, or let's say apples, some fruit, and maybe you had some water to go along with it, or another beverage such as black coffee if you drink coffee. And then for lunch, your lunch was focused on whole grains, legumes, and vegetables. In this particular example, these are whole grain tortillas that happen to be filled with black beans and tomatoes and bell peppers, along with some healthy fat with the avocado. And they actually have some greens in them, such as kale. But you can imagine that any other legume or bean, black-eyed peas or lentils with rice, brown rice, for example, that might be your lunch. And on dinner, here is another example. These are chickpeas, along with a whole wheat pita instead of a white pita. And then half of that plate is a salad with kale and vegetables, along with fruit. And then for snacks, you might focus on an unsalted nut or seeds. And here it might be an almond butter or a peanut butter that is unsalted, along with an apple to dip, so you have a little bit of protein along with your fruit. Same thing for this other snack plate that you see. It's some vegetables along with some chickpeas. Maybe it's some vegetables and hummus. This is what a full day of eating a whole food plant-based diet might look like. So we also want to focus on whole foods. Remember, we said the less processed, the better. So on the left-hand side, you can see that we want to choose to eat the fruit instead of that fruit juice, because it has more fiber. It's going to not increase our glucose levels as quickly as drinking the fruit juice. The beverages in the middle, we would want to choose water instead of that highly processed artificial beverage. For a snack, instead of choosing something that's processed out of the vending machine, we can have those apples and almonds, or apples and peanut butter, or hummus and vegetables. So choose whole foods. So in this particular scenario, the whole foods we would have chosen would have been the orange, the water, and then the snacks of fruit plus an unsalted nut. The less processed, the better. Remember, we talked about the fact that with type 2 diabetes, we don't only think about glucose, we also want to think about salt and fat, because high cholesterol and high blood pressure are something you also want to think about and manage. So here are some examples of what being aware of your salt might look like. So packaged and processed foods, as we talked about, one of the ways that foods are processed is salt is added to them to preserve them. So packaged processed foods, in fact, sometimes breads that are processed are high in salt as well. So the more you can avoid any type of packaged or processed food, and the more you can cook at home, the better. In fact, you don't want to add extra salt to your food if you don't have to, but think about the fact that most of the salt in people's diet comes from packaged or processed foods. So when you cook at home, choose to use herbs and spices instead, but mostly think about how many packaged processed foods and beverages you're eating and drinking that might have salt. So the less salty choice in this particular scenario, instead of a canned bean, might be a dry bean. Instead of a salted nut, would be an unsalted nut or seed. So it's important to be aware about and think about salt. Now let's talk about fat. In this particular image, we're showing what a mostly plant-based diet would be, but if you're not avoiding some animal products. So for example, you want to avoid or eat less red meat specifically. You want to avoid butter, full-fat cheeses, and full-fat dairy milks, specifically when we're talking about type 2 diabetes. You want to focus instead on the lean proteins, which would be the legumes or pulses and beans, fish, and chicken. And you want to focus on good fats instead, such as avocados and nuts. So it's important to think about where you're getting the fats in your diet, because as we talked about, high cholesterol is also the cholesterol is also important to people who have type 2 diabetes. And when you're choosing whole foods, plant-based foods, you choose things such as an avocado, or you choose things such as nuts, and those are natural foods that have better fats than the alternatives. We've talked about what types of foods that you want to choose, but also remember that portion sizes will be important. So how much you eat. Remember, I talked about that plate that you see the photo here on the screen that was served to us that actually looked more like a platter for multiple people, but it was meant as a plate for one person. So think about what size plate you're using, how many servings you serve yourself. Did you eat a 3-course, 5-course meal, or did you have one plate? So your portion sizes and how much you're eating will also be important. So the idea is that you want to nourish yourself, right? So food is meant to nourish us. And the way to do that is focus on eating regular meals, but have them be whole food, plant-based filled. And in order to do that, you want to have less processed foods, less fatty foods, sugary drinks, foods, and salt, and eat more things like pulses, legumes, as well as unsalted nuts and seeds. Eat more fruits and vegetables, and choose whole grains. This is the way that you can nourish your body, not just for type 2 diabetes, but this is ideal for things such as cancer prevention as well, where there's evidence from eating a diet such as this. So if you are watching this now, you can feel free to write in the chat box if there are some things you already do to eat a whole food plant-based diet. I'm looking at the chat box now, so I'll be able to see if you write it. And if not, we'll share that one of the things that we do is when I go, for example, to buy fruits, we wash them and get them ready as soon as we buy them, and then we put them out on the plate on the kitchen table. So there are plates full of washed and ready fruits to make sure that if somebody's looking for a snack, the first thing they're going to see when they walk into the kitchen is a bowl of fruit that's ready to eat. Same thing with vegetables. You can cut them and have them ready in the fridge so that if you're looking for a snack, you don't turn to something packaged, but the first thing you see, the first thing that you look at when you open the refrigerator is some chopped veggies, for example, with some hummus container right next to it. So that's one thing that we can think about in our house to make it easier to choose whole food plant-based snacks. Maybe there are some things that you do as well. So you've been hearing today about a whole food plant-based diet, and let's say this has called your attention and you feel like you want to start to move towards a more whole food plant-based diet for type 2 diabetes prevention or management. So how do you start this? One way to do this is to set SMART goals. So what is SMART? SMART is an acronym. So an acronym where the letter SMART stand for 5 different words. The first word is specific. So what is it that you actually want to do or add to your diet or change? The second word is measurable. How much or how many times a week are you going to do this, add something, change something? The third letter, A, is for achievable. Do you actually have what it takes to follow through? For example, do you have fruits and vegetables in your kitchen? Do you have the capacity to go out to the supermarket on Sunday to get what you need? The fourth letter, R, is realistic. What can you do? Do you really expect that you're going to throw away all the processed foods in your house? If there are other people that live in your house besides you, maybe they might have something to say about that. So you have to choose something that's realistic for you and your situation. And time-based, how often are you going to do it? When are you going to start? How long are you going to do it? Noting that when you set a SMART goal, you want to set a goal that is small, like a 1 week goal or a 2 week goal, because it's easier to take that goal, try out the change, then evaluate after that 1 week what happened, what obstacles did you encounter, how can you change that goal a little bit to make it fit better within your life. So let's give an example of what a SMART healthy eating goal might look like when we're thinking about a whole food plant-based diet. So let's say for you, maybe you work all day long and you're starving when you're at work, and the first thing you see is the vending machine or the periptero or the kiosk right around the corner, and you're just so tempted to go get something that you end up buying a processed snack. For example, for you, you might be thinking, I want to take a whole food plant-based snack with me to work, so that I have 2 snacks with me each work day for the next 1 week. I'm going to try this, and I'm going to start that on Monday. So starting on Monday, I will carry 2 whole food plant-based snacks with me to work each work day for the next 1 week. Is a SMART healthy eating goal, because you've said, what are you going to do? You're going to carry those 2 snacks, and they're going to be whole food plant-based snacks. Maybe you have in mind that you're going to take some hummus and veggies, or you're going to take some unsalted nuts and some fruit. And you're saying you're going to do that every work day. So you're going to get ready. You feel like you have fruits and vegetables and the snacks you need. You have the capacity to plan that this weekend, and you're going to pack that, let's say at nighttime, get ready so it feels achievable, it's realistic for your life, and you've chosen when you're going to start and how long you're going to do that. And your trial is in a reasonable amount of time. It's 1 week. You're not saying that you're going to do that for all of 2021 and 2022, which would be a much harder goal to achieve. So setting a SMART healthy eating goal that you're able to try out and more likely to achieve makes it easier for you to make goals about your diet or about anything else in your lifestyle. So instead of just saying, well, I really want to eat healthier snacks at work, or I really want to have healthier snacks for my family, at home. That's not a goal that's written in the SMART way, as opposed to the second goal that's on the bottom of the screen right now, where you said, starting on Monday, I'm going to take 2 whole food plant-based snacks with me each work day for the next 1 week. So Monday, Tuesday, Wednesday, Thursday, Friday, and I'm going to try it out for 1 week. What happens? Saturday or Sunday comes around after next week, and you're going to think about what happened during that week. Was there one day that you forgot? Or maybe you never made it to the supermarket because something happened on something. So you think about what obstacles did you encounter? And then think about what can you do to overcome those obstacles. Maybe you decide that taking 2 snacks is just too much work for you. So you're going to start off with taking 1 snack that's whole food plant-based to work with you each workday, and try that for the second week. And then at the end of the second week, you reevaluate what happened. Did that work for you or did that not? So the important part is to set a goal that's SMART. And then the most important part is to reevaluate it at the end. So In the clinic of the University of Nicosia Medical Center, many of the physicians and the people who work there use SMART goal forms that allow you to log what is your SMART goal, to think about what are your obstacles, and to check off how and if what happened every day. Let's say for that next week or 2 weeks that you chose that goal. So you might want to think about doing that. Write down your goal and track it and see what happens, because the idea is to make progress. It's not perfection. So I'm looking at the chat box right now. Perhaps you have some thoughts about a SMART goal that you might want to try. We talked about a snack SMART goal. So if anybody wants to say or share what type of goal they're thinking about after our conversation today about a whole food plant-based diet. Perhaps some of you are thinking about, I want to increase the number of vegetables I'm eating in my diet, because maybe you only eat vegetables twice a week. So maybe you decide that you're going to go from eating vegetables twice a week to say that you're going to try to have one vegetable a day from Monday, Tuesday, Wednesday, Thursday, or Friday of next week for lunchtime, and you're starting on Monday. And maybe you've decided that you actually want to have one green vegetable. So it's going to be like kale or spinach or something like that for lunchtime every weekday for next week. And you're starting on Monday, you're going to try it for 1 week. So that's one goal. Seeing if anybody has given us some thoughts in the chat box of what they want to try. So remember, our idea is to try to move towards a more whole food plant-based diet that's filled with legumes, whole grains, seeds, nuts, fruits, and vegetables. So for example, maybe you are used to eating white rice, and you're trying to move towards more whole grains, so you want to move towards more brown rice. But let's say you don't like the taste of brown rice as much as you like the taste of white rice. So what some people do is they mix. So if you're cooking and you measure out 1 cup of white rice to cook it in your pot, you might do 3/4 of a cup of white rice and 1/4 of a cup of brown rice, and try that this week. So let's say I'm going to try that on Wednesday or Monday or Friday when I make rice for my family. I'm going to try to add a 1/4 cup of brown rice instead of white rice, and we're going to taste it and see what happens. And then you're going to try that for 1 or 2 weeks. And then you're going to say, oh, you know what? That brown rice, white rice mixture wasn't so challenging for me. So I think that I can go to half brown rice, half white rice when I cook. And so on. You would move forward in the next few weeks to try to move towards more brown rice, less white rice. And even though you're taking it slowly, you're moving towards incorporating more of a whole grain into your diet. And I see that somebody's written in the chat box that they have a question, and I'll just look and see if anybody has any SMART goals, and then I'll work to address that question in one moment. So thank you for your question. I just want to remind what I said before is that the goal is progress, not perfection. And that's why SMART goals can work for you, is because you take a chunk of time, you try something, and then you reevaluate it, go through the obstacles, adjust your goals so that you can keep on moving forward towards the direction you want to head, which is a whole food plant-based diet. Every little step in the right direction helps. Even though there is some benefit, for example, if you choose to go fully to a whole food plant-based diet and restrict all animal products, as I said before, the less animal products you eat, the more likely it is the less risk of diabetes you might have. But what really makes a difference is that it's going to fit into your life, and this is going to be something that you're going to be able to continue and work with. And that's why making a SMART goal that fits within your life, it's a goal for you and not by somebody else, set by you, is what's going to be important, because every step in the right direction is going to help. So I'm going to go into the questions in a moment. I'm just going to summarize first, which is, We've talked today about how you can actually take charge of your lifestyle and prevent or manage your type 2 diabetes. We talked about the fact that eating a whole food plant based diet can help prevent diabetes. Let's say you have a family history of diabetes, there's something you can do about it to do your best to move toward preventing yourself from developing type 2 diabetes. Or let's say you've already developed type 2 diabetes and you want to see if you can go into type 2 diabetes remission where all your blood work goes back to normal. Um, you can do that with a whole food plant-based diet. So choose as much as possible to move towards a whole food or plant-based diet, but start with small steps that are meaningful for you, things that you want to try or you want to do, and start with some small, smart goals. So 1 or 2 goals only. Don't choose to do 7 goals for the first week. Just do 1 or 2 smart goals and then follow up to see your progress. You can do this with your clinic team. For example, the University of Nicosia Medical Center physician team, or there's a registered dietitian, nutritionist there that can work with you to help you think about your goals and help you see your progress, help you adjust when you encounter obstacles. So work together with your clinic team. Now, I'm going to go into answering the questions, but before I do that, I just want to point out that if you are watching this live stream from the University of Nicosia website, at the bottom of that screen, as you can see here, there's a little red box that says feedback form. If you click on that, it will take you to an anonymous feedback form where we would truly appreciate your feedback to help us continue to improve our sessions. The same thing if you are watching this on YouTube, you'll see, as pointed out by the arrow here, that there is a link that says feedback form. We welcome your insight, your input. It will be anonymous. So while I start to answer questions, just think about whether you can do that feedback form and give us some input. So now let me turn to that question that I had in the chat box. And if there are others of you that have questions, please fill it out there. So the question reads, is it better to eat unleavened bread than leavened bread? As leavened bread has yeast, which needs sugar and salt, I assume that will be worse. Is pita unleavened? So in reality, when we're talking about the topic that we're discussing today, the best thing to consider is whether the bread is a whole food plant-based bread. So if you are using a whole grain, that's even more important than the considerations about whether it's leavened or unleavened. As to the point about whether yeast needs sugar and salt, it is true, but the amount that's used is usually minimal. So if you do choose an unleavened bread, it would have less sugar. If you have a fresh homemade bread, it would be less processed and less likely to have as much salt as one that you would buy packaged from the store, for example. So a homemade whole grain bread would be, with, let's say, one that's full of seeds as well, would be the best way to go. And I'll just point out something that I didn't mention earlier, that we want to focus on a whole food plant-based diet that has legumes, whole grains, and I mentioned unsalted seeds and nuts. When we want to think about the amount of foods that we eat, when you eat things like nuts, you just want to be careful of your portion sizes because they are filled with natural oils. And so if you eat a cup full of almonds, for example, that's a very calorie dense food. That's a lot of calories in your diet. So just remember that you want to also think about your portion sizes when you talk about things like nuts. And as I said before, you want them to be unsalted nuts and unsalted seeds as much as possible. So I'm looking at the chat box and seeing if there are any other questions from today. No, okay, it looks like the question about unleavened bread has been answered. So if you have any other questions, please feel free to add them to the chat box now. Otherwise, know that if you are able to give the feedback form and complete it for us with those 2 links that I shared with you on how to find, we also look towards your suggestions about what future topics you would like to hear about from the University of Nicosia Medical School and University of Nicosia Medical Center, specifically about lifestyle or anything else. So also that feedback form can help you give us suggestions about future topics about which you would like to learn. So In summary, we'll say that today we've talked about a whole food, plant-based diet for type 2 diabetes prevention, management, and treatment. Something that can lead you to go into type 2 diabetes remission if you go into a fully whole food, plant-based diet. For example, people rather quickly can manage their diet, lose weight, control their BMI, normalize their sugar, and normalize their improve their ameliorate their insulin resistance. So if you go directly into a fully whole food plant-based diet, you might see some quicker changes than if you take a slower transition. But what it really depends upon is you. Is it going to be better for you to take your time to adjust to the diet? Because in the longer term, you know that's what's going to be long lasting for you, because what you want to do is choose a eating pattern. Remember, this is not a diet about just something short term. This is modifying the way that you eat so that you can live a long in the longer term, as healthy and meaningful a life as you would like. So just in case you would like, I've just put 3 resources that you'll be able to see: one from the American College of Lifestyle Medicine, one from the Harvard Health Blog, and one from the NHS, that gives you more information about plant-based diets, vegetarian and vegan diets. And this is then I'm just double checking to make sure there are no other questions in the chat box. As I don't see any other questions in the chat box, I'm going to say thank you to all of you for joining us tonight for tonight's conversation on a whole food plant-based diet. We look forward to receiving your feedback and to you joining us in future sessions. We send our sincere thank yous from the University of Nicosia Medical School and University of Nicosia Medical Center today. So thank you.